thank everybody for coming this morning. I know that we told you that we were going to keep you updated, keep the public updated, because we want them to know that we are all working together during this time to ensure public safety is for everybody. So today we have several different speakers. We have some of the cities with us as well. So they'll give you a little bit of what we're doing. But most importantly, what we've talked about in the past week was the medical surge. What are we doing to relieve capacity from our hospitals? Because we know that our hospitals will be inundated just from our regular work that we see coming in and out. So we have said that we were going to put beds together so that we could manage that surge. So most of you know that we have been working on the beds for the homeless. Those are coming online soon, and so we'll keep you updated as we come online. What I would say to the public is thank you so much. We had so much support from people that want to help and be part of that discussion that we feel comfortable and ready that we will absolutely be able to care for them. Secondly, I want to tell you a little bit about some of the beds that we have in contract today, and we are working to get them up and ready to go. And know that this work is going on every single day, that we are working through this. Priorities change a little bit, but we are working hard to be prepared and to be ready so that the general public understands that we take this serious and we're all in it together, and we will do it. So before I do that, I want to tell people there's some great things that you're doing. We are doing well on social distancing within our state, so we should be commended for everybody taking that very serious. As the governor said, social distancing is making a difference, and we want to encourage people to continue that social distancing piece. But along with that social distancing piece comes this. Please don't forget to check on your neighbors. Many of my senior neighbors I call each day just to see that they're doing okay, because social distancing for some is very hard, but it doesn't stop you from picking up the phone and talking to your neighbor to make sure that they're okay, they have what they need. It doesn't stop you from calling the kids in the classroom that they may have had, just so that the kids can also talk to their friends, because this is all new and very different for everybody. But what I will tell you, you are saving lives every single day that you stay home and you're not spreading this virus. So I thank you on behalf of Clark County Commission, but on behalf of the entire valley, for doing your part and staying home when you can. But let's talk about those beds that are out there. So as of today, we have 32 beds at the Salvation Army, which are for individuals who are 65 and over and have underlying medical conditions. Why is that important? That's important because these folks are at a higher risk to getting the virus and to having complications. Secondly, I mentioned last time we have a partner at Crossroads of Southern Nevada. They currently have 39 beds that they have been working with us for isolation. We also have Well Care Services, which is 114 beds. And those 114 beds are also available for isolation and ready to go. So that means that in our community today, we said that we would work towards the goal of 500 outside of our homeless commitment that we had. We have 150 of those 500 beds solidified, and we will continue to work every day. We're already making calls, trying to get ready for the next one. So with that, I just want to say again, thank you to everybody for adhering to the social distancing. I know it's very hard for all of us at this time, but it really is saving lives. If you don't need to go out, please don't go out. But please don't forget, we're such a compassionate community. Call your neighbor, call your child's friends, check on them, make sure that everybody is still doing okay. So now I want to introduce Kevin Schiller, who is over Assistant County Manager, to talk about how do we all cope with this, because this is hard for everybody. So I want to give some tips to the general public on things that you can do. So, Mr. Schiller?
Good morning. As everybody knows, with people being isolated and our changes and the impacts to each of us and our families, one of the key pieces to this is really the behavioral health and the mental health side of this and stress management. So one of the key pieces, people that may be experiencing immediate crisis, those that are really struggling and need to talk to somebody right away, and or those that need local resources, the biggest resource that we can lead you to is Nevada 211. I've handed out a sheet which talks about various resources, but for purposes of simplicity, people in crisis, people that are struggling to manage things, Nevada 211, which is as simple as dialing 211, will connect into centralized resourcing so we can support anybody that's out there in the community. This is in collaboration on a statewide level with the state of Nevada, and they also link into our county resources. In addition to that, that resource line can also assist as we look at social services and we look at those in financial crisis as we continue to work towards rental assistance and other pieces that can be beneficial. One of the key things that I want to make sure I emphasize with the changes and the financial impacts to families is some people do not want to reach out. Some people are afraid to do that. What we want to really do is encourage people to call Nevada 211 so that they can get the help they need and so we can assist them. Again, this will create an open door as we look at resourcing for other areas so we can help reduce that stress level and help with that management. With that, I'd like to introduce Chief Steinbeck to come up and speak a little bit.
Thank you. John Steinbeck, Fire Chief for Clark County Fire Department. I'm also the Emergency Manager for Clark County. I want to thank Kevin Schiller for the work that he's doing with those social services. A lot of times people like me that are in uniform and I get a badge, the public's very quick and we love it. They come up and they thank us for our service, but there's a lot of people out there that are keeping this community safe and going that are not wearing a badge. And Assistant Manager Schilling is one of those. So thank you very much, Kevin. You'll see on the side of me here, I've got General Barry from the Nevada National Guard, and then I've also got Justin Luna, the Chief of the Nevada Division of Emergency Management. They're both down here to assist us with working through a lot of the logistics and the coordination, and the reason that they're standing behind me at this point is to just show everybody how unified we absolutely are. A lot has been in the news about the National Guard's involvement. I want to make sure that everybody's well aware that we do this all the time with the National Guard. A lot of times it goes unnoticed, but we work closely with the National Guard all the time. And when the National Guard comes in, they integrate in with the local command structure, and it's pretty seamless. So they work as a force multiplier for us with any of the activities that we may need. And right now, that's a lot of logistical support. So they're assisting us with that. The PPE situation has gotten a little bit better, and I want to stress a little bit better. We still have a lot of shortages in regards to PPE. We certainly are still facing a lot of the same challenges, but we have received the national stockpile here, and the last of it will be distributed out by the end tomorrow to those organizations and jurisdictions and our frontline healthcare workers as far as it'll go. It'll still leave a lot of shortages, so donations have been coming in and the purchases. And that's what the National Guard is helping us to go ahead and not only bring those in, but also to push those out. For local donations, though, we still have our donations manager, and that phone number is 702-455-0006, and also can be reached by email at esf6.donations@clarkcountymac.com. And that's how we can go ahead and utilize the donations and also assist with some of the needs that are here in Southern Nevada. As far as the fire department goes, I want to just let you know what I did last week. We're still at full strength. We're running our calls as we always have, and you can expect the same level of service as you've always gotten from the Clark County Fire Department and your other area fire departments. We've been able to maintain that. You will see more often at times, I've got my mask here, and the people that are coming to see you every day, they'll have their mask on as well. That's not only to protect our first responders, but to adhere to the social distancing the best that we can, and to protect the public to our fullest capability. So you'll see different levels of PPE that will be on, even for routine calls that do not involve that does not involve the COVID-19 crisis. So I want to reiterate, the public's doing a great job of not abusing the 911 system right now, or even using more discretion than ever before. We appreciate that. Please keep that up. Again, though, it's a balance. We also want you to call us when you're needed, when we're needed. So if it's particular to the COVID-19, if you become what we call cyanotic, so you're starting to see some blueness around your lips or on your face, if you're having difficulty breathing or there's an altered level of consciousness, then please do utilize that 911 system so that we can go ahead and assist you. And then, of course, the regular medical emergencies that we always care for every day, those haven't changed. If you're having chest pains, if you're having a diabetic issue, or of course if there's an emergency involving a vehicle accident or a fire, we're there to assist you, and we're ready to go. General, do you have any words that you'd like to say?
First of all, thank you, commissioners and everyone. I can't echo enough that you're doing the exact right thing, and we get a chance to watch this nationwide and see from my peer group some of the strategies and how they're working in collaboration with their respective communities. It's the exact right thing that's happening here. I just want to say also that for your National Guard, we are here to support. The chief said it exactly in terms of we were here as a resource. We can help with logistics, transportations. If you get to more drive-through testing, anything like that, we will work under his direction to make sure that we are here as a force multiplier. And anything we can do to protect the citizens of Nevada, I will promise you the Guard is always ready, always there. Thank you.
Sir, can you get your name right?
Yes, my name is Andre Berry, ONDRABERRY. I'm the Adjutant General for the state of Nevada, Major General Berry. Thank you.
Thank you, General. Mason, if you'd like to go ahead and come up now, then I'll turn it over to Mason from UMC to go ahead and further this discussion. Thank you.
Thank you, Chief Steinbeck and General. Mason Van Houweling, Chief Executive Officer of University Medical Center. I just wanted to give you an update from my last update in regards to the hospitals and the facilities here in Clark County. Just know Nevada hospitals and our local hospitals in the Valley are working tirelessly to prepare for a surge here in Las Vegas. We have working every day and every night, but we anticipate an increase and we're seeing an increase in COVID-related symptoms. First of all, I just want to say thank you to the community for staying home and being safe. It is working. Thank you for only seeking out medical care if you absolutely need it. It's helping our emergency rooms and our hospital beds as we speak, and utilizing those things like telemedicine or Ask a Doc or Ask a Nurse has helped. And always reach out to your primary care physician for your medical needs. But if you're acute or severe, please seek out the emergency rooms if you absolutely need it. I also want to just say thank you to our community, our wonderful community that have and continues to donate PPE to our first responders and our hospitals. It is making a dent in it. So it is helping, so please continue to help us out in that regards. Just some of the projections related to the Institute for Health and Metrics and Evaluation. It's estimated that the state of Nevada will reach its peak around Friday, April 17th, with the potential of ICU bed shortages. I just wanted to take you through some of the Clark County numbers as far as our beds and occupancy, and then get into a little bit of a specific with UMC. So Clark County, we have 609 beds, ICU beds. 481 of those are occupied as we speak, about 79%. Our ventilators, 681, and those ventilator numbers continue to go up, whether it's our emergency response of the Guard or our hospitals continue to source ventilators. But out of the 681, 348 are occupied, or 51% of our ventilators. And then our overall hospital census of 4,542 beds is at 65% occupancy, with 2,935 of those beds occupied. At UMC in particular, we have 106 ICU beds. 83 of those are occupied. That is down over the last couple of days. Our ventilators are 133 ventilators at UMC. We're at 60 this morning, and that's down about 3 or 4% from the last couple of days. Of those, 32 patients are COVID patients utilizing ventilators, and our overall bed occupancy is about 60%. Just in the Valley, we've got 314 patients, positive COVID patients admitted, with about 300 that are PUIs or suspect patients. The average age of the patient that we're seeing is about 52, and right now 55% are female, 45% are male. Just some of the highlights throughout the week and that we're doing on the patient care front. We have, in order to preserve our ventilators, our medical community here in Las Vegas has been proning patients, which is basically turning them on their stomach in a swimmer position, which has allowed us to use high-flow cannulas to help keep patients off ventilators and keep them off mechanical devices. We're seeing that work in our hospitals, which I think is making a huge dent in utilizing ventilators. We've also heard about some of the screening protocols that you heard last night from the White House. We all are implementing those screening protocols for our healthcare workers. We've also, in the last 2 days, set up a medical surge tent, a 22-bed tent outside the hospital of UMC, but many other hospitals are doing the same. And just on the PPE, we are in current yellow status, which means we're okay, but we could be very quickly fall into, as we see the surge, into a red status. So continue to please help us out with PPE where you can. So with that, I'll take questions later as the rest of the group, but I'm going to introduce Dr. Legan, who is our director of the Southern Nevada Health District. Dr. Legan.
Thank you, Mason. Good morning. My name is Fermin Legan, acting Chief Health Officer, Southern Nevada Health District. First, I want to say that today we have 2009 confirmed cases of coronavirus in our community. That includes 71 deaths. And really, I want to express our condolence to the family who have lost a loved one. We recognize the extraordinary work that is being done by our colleagues at the hospitals and medical centers and primary care offices to make sure that our community receives the best possible medical service. And unfortunately, still we are losing loved ones, so I just want to express our condolence for that. I also want to say that starting yesterday, we are offering an estimate on the number of recovered patients, and I emphasize estimate because due to the large volume of cases that we have in our community, our surveillance staff is not enough to actually do a full follow-up in terms of asking previous patients about their recovery. So we are estimating that based on different elements or criteria that we are using for that purpose. Right now, we estimate about 727 individuals have been recovered from this disease in our community, which is about 36% of the total patients. I also want to talk about the mask, and as you know, the CDC in recent days, they modified the recommendation for the use of masks to the public, and now the CDC is recommending that everybody, once you are in public places, should wear a mask, and they are recommending any kind of clothing covering your face. It doesn't have to be a surgical mask or an N95 mask. Those two kind of masks are reserved for healthcare providers and primary and first responders because of, as you heard before, we are running into a deficit of those masks. Actually, myself, I'm wearing a homemade mask. Actually, my wife made this for me, so that's what I'm wearing. I'm not trying to wear a 95 or anything like that, so I'm not trying to take any advantage from the system, just using the same that we are recommending for the public. And it is important because by wearing this clothing material, when we are in public, we actually are protecting the public. We are preventing ourselves from spreading the coronavirus to other members of the community. As we heard from multiple sources, this is a virus that could be transmitted by people who have no symptoms, no signs of the disease. And that could be somewhere between 25 to 50% of people who are infected. So even if we go with the lowest figure of 25%, we're talking about 1 out of 4 individuals infected who had no sign or symptoms and is able to transmit the disease. So it's important for us to protect our community for that. Also, it's important as well as we wear the mask or this facial clothing to make sure that we keep social distancing. And the recommendation is to stay at least 6 feet or 2 meters, from other people, especially when you go to public places like a supermarket where it's very difficult, almost impossible to keep that social distancing. Well, we emphasize to please make sure that you wear a mask so you are protecting yourself and the public. I also want to talk about testing. Testing has been improving in the community as we progress. From the public health standpoint, our lab here in Southern Nevada has increased its capacity in recent days. And, we had a limitation with the number of extraction kits. It's an element that allows the lab to run the coronavirus test. Now we have about 8,000 of those kits, and right now our lab capacity for testing grew up to about 5,000 tests. Our daily capacity is about 60 tests per day. We also have been partnering with our public health lab in the north in Reno, and also with the lab at UNC as well. They have helped us when we have been overwhelmed with the number of specimens to process a single day. And I also want to say that right now there are other hospitals in the area that also have in-house testing for coronavirus, which is very helpful for our response. Also, I want to repeat what I had said last week. Right now, we have the commercial labs are available for testing, and that allows the primary care providers or your doctor's office to be able to test you for coronavirus if they have that suspicion. I also want to say that the health district has been assisting our partners in the community. In recent days, we have been working with the Salvation Army and also Catholic Charities a couple of weeks ago with issues that they had in terms of screening and testing the clients, members of the homeless population who represented with respiratory signs, symptoms, and there were concerns about coronavirus transmission. So we help them with that, and also we share part of our personal protective equipment with them, even so that, as everybody knows, all agencies right now are close to yellow or close to being in the red with personal protective equipment. I just want to emphasize that in terms of general precaution for this disease, which is important, First, again, making sure that we keep social distancing, staying home as much as possible. If we have to go out in public, please bring a mask or facial clothing with you so you protect yourself and those around you. If you have any sign or symptom that you might suspect is related to coronavirus, any respiratory sign or symptoms, before going to your doctor, please call that office and let them know that you are presenting with those signs and symptoms, so they can give you recommendations over the phone, or they might ask you to come over. Right now, most medical offices are offering telemedicine, so they most likely will provide advice to you over the phone or an electronic device, and they will tell you exactly what you need to do, and if you need testing, they will give you the instruction how to get that done. I also want to emphasize that for this disease, coronavirus, testing is important, but it's more important for those who have a severe sign or symptoms, and those are usually the patients who go to the emergency department or the hospitals. Most of the presentation for this disease are mild symptoms, which usually don't require testing. And then your doctor might give you instruction about basically stay home and just be safe. So having said that, I want to introduce the mayor of the city of North Las Vegas, Mayor Lee, please.
Thank you, Doctor. I used to think that superintendent, I told everybody that Superintendent Jara had the toughest job in the state of Nevada, being Superintendent of Clark County School District. But at this point in time, you do have the toughest job in Nevada, and we appreciate all that you're doing. I want to thank the Southern Nevada Health Department Board for what they're doing, and Scott Black as their leader, and Chairman Kirkpatrick as vice chair of that committee, and your leadership at the County Commission. We need the County Commission to continue to be at the forefront of what we're doing. The cities depend so much on the county. You're such an integral part of the success of this whole state. We are following state's directives in North Las Vegas, and we are trying to get this over with as quick as we can onto the recovery sooner. Our residents are doing a great job in that. They're paying attention, and we have got the word out. Our city staff is working with we've got some sent over to the fire department. We're calling businesses. We're letting them know what we do. We have had no enforcement yet on business licenses of people who are not doing the directive that we're supposed to be following about essential and non-essential businesses. Yesterday, we took the proactive step of setting penalties for anyone who violates emergency directives. And this also helps us as the governor finds more reasons to send more directives. We don't have to have special city council meetings to vote on these things. Whatever directives that the state sends us that will keep our residents safe, we will just automatically apply them and enforce them. This is brought on by Councilman Barone, who, like the rest of us, received complaints about residents being locked out of the home when they went to the store to get some food or to do something they needed to do. So the directives that we put together are going to penalize anybody who violates those directives. I also want you to know that we are doing the best we can with our employees. We're doing a lot of work at home. We're social distancing, and our business code enforcement, men and women are staying at home. We're having the contractor hold a camera and show everything that's happened in the inspection process, and we are doing a great job there keeping the city open. And although this has disrupted our lives day to day, day in and day out, we will come out of this stronger. We will be prepared next time something happens like this to take it more seriously in North Las Vegas and in the county, to have an action plan that's developed from this experience. So we appreciate you, Chairman Kirkpatrick. Thank you for putting this on, and we're looking forward to brighter days. And with that, I get the opportunity to also introduce another wonderful mayor from Boulder City, Mary McManus.
Thank you. Again, I'd just like to echo much of what's already been said here. The help that the Clark County government has provided. We're a small city in Boulder City. We rely on that type of assistance from others. I also had conversations or was in telephone meetings with Representative Susie Lee and Representative Dina Titus yesterday. I know that our federal delegation is working very hard to get funding to us and also to look forward to how we recover from this. In Boulder City, I'm a native of Boulder City. It never ceases to amaze me the type of volunteer spirit that always comes out in our community. So I want to really thank the nonprofits that we have out there that work year after year, but especially at a time like this have stepped up. Our senior center, emergency aid, lend a hand. We've also been getting volunteers just calling our city staff, volunteering their time. They're able to make calls out to our community, touch base with some of those folks who may not be hearing from others. It's already been mentioned, call your neighbors, call your friends, call your family. Let them know that you're thinking of them, that there is help out there for people. There are many resources right now that I think people need to be aware of, and if they need that help, please ask for it. I also want to say thanks to all the healthcare workers that have done such a great job. We have a small hospital out in Boulder City as well as the Nevada State Veterans Home. Those people are on the front lines putting their lives at risk so that all of us can be safer. So again, I want to really thank all of them. We're going blue this week for recognizing the efforts that they have. And lastly, I'll just say that, again, we are going to get through this. And this is going to be difficult for many of us. There is a lot of help out there, so please ask for it. And with that, I'll return it back to Commissioner Kirkpatrick.
Thank you. And again, this is the importance of how great our community is when we work across aisles, across a county line, city and county lines, so that we're all working together. And last week we told you about the importance of the multi-agency group that comes together. We meet once a week. We meet on Mondays, and we talk about the issues that are coming up through the week. So this is a testament to what we do best in our community. Last week, I asked you all, I gave you some things that we needed, right? Some donations, some locations to look at, and you, the community, came through with tons of places for us to look at. This week, I'm asking, everybody says, what can I do? You can stay home this week, take a deep breath, be patient. There's a lot of nonprofits, agencies, both state and local government, that are trying to help you to put all those resources in. And if you could just stay home this week, be patient, check on your neighbor, that will be beneficial to our essential workers that we have out across the community. So please, it's so important. I can't tell you how that is. Secondly, if you really want to do something that's going to make a huge impact in our community as we come out of this and we start to recover, please fill out the census. I cannot stress the importance of filling out that census, because today, as we're in the fight of our life to get our fair share from the federal government, we're a small state, and this does make a difference on how we get these resources. We know that it's going to be 12 to 18 months at a minimum for us to start to come out of this. So I need everybody rested. I need people ready to go, because we are coming into our peak season, and there is going to be a lot of ways that you can help. There's going to be a lot of ways that you can help us recover and move forward. So with that, I can't thank the community enough for coming together. This is the very place that I grew up in, that I love to call my home, and these are all the reasons that I do call it my home. So we'll open it up for questions, any questions that you want. What I'll ask the speakers is to repeat the question so that everybody's very clear on what's being asked. So I'll open it up for questions at this time. Yep. Okay.
Hi, Jeff. How are you? So the question is, how are we seeing the effects of social distancing impact the hospitals here in Clark County and throughout the state? And what effects are we seeing? We look at a lot of models throughout the community, and we are seeing lower projections than what we've seen. The general's here too. I think from a state standpoint in Clark County, we are seeing it be effective. Could we do more? Absolutely. And you've heard that from all of our speakers here today. Dr. Lagan said it very well, that very mild symptoms, we know testing is limited, but mild symptoms can be stayed home and worked through with your primary care physician. But we absolutely, if you're severe respiratory illness, acute underlying symptoms, seek out emergency care for sure. But my anecdotal and just what we've seen is the volumes could have been a lot worse if we didn't implement a lot of things that we've done here in the state, the county, the cities. So as Commissioner Kirkpatrick mentioned, our collaboration has been amazing and it's been very effective. And we did a lot of things very early on to minimize as much as we can. And then we continue to work through what we're learning from other states and other providers. And we're on a lot of calls where we're sharing information, but it is being effective. But we could do better. And like Commissioner Kirkpatrick said, stay home, be safe, take a pause this week, because we are anticipating approaching some peaks over the next couple of weeks. So it's been very helpful. Okay. Sure. And the question, I'm going to probably defer it to my very good friend, Dr. Lagan, because it sounded like a health district question. But Dr. Lagan, it was the question about reporting numbers more frequently so we can capitalize or formalize some of the numbers that we're seeing on some of our positives and suspect patients. So did I get that right? Yes. Okay. So testing more frequently, or reporting more frequently, sir.
Okay, thank you. Well, actually, there is a daily report regarding the number of confirmed cases in the state and the county. It is published every day. So I don't know. We can share with you where you can find that, but it is actually a daily report that is available to the public through the state website and our website as well.
And so let me help with that. So that is actually something that through the state, at the end of every day, because what's happening is the numbers are changing constantly, right? So in order for us to give the public a consistent number, because what we found in the early beginning, and you have to understand from Clark County's perspective, we have 70% of the numbers, right? And the numbers are changing as you heard. So at the end of every day, there is a number that is reported up to the state, and I believe it's 10 o'clock at every day the state releases that number for that time period. If we were trying to report as it happened, we would have numbers that we couldn't actually verify to be true because they would be all over the place. So understand that today the numbers are going in at the end of the day. I believe it's 3 o'clock, and then at 10 a.m. they are released, because what we don't want to do is put numbers out there that we can't verify, because remember, we also have to notify families. We have to do reach out so that people know who's impacted, and there's a whole investigation process that goes through. And I want to just give a shout out to Dr. Lagan, right? Because in Southern Nevada, we get beat up a lot about we're not working as hard or as fast, but understand that we're taking 75% of the cases across the state. and we have the bulk of the population. So I can tell you that the gentlemen that are all standing with me today, we don't sleep, right? Because our number one priority is public safety. Our second priority is making sure that we get good numbers that are out there. So we want to be very transparent on what we're doing, but we want it to be accurate. So I know that's a little more than you asked for, but every day those numbers change. Every hour that number is changing, but we want to give you a consistent time each and every day. And we'll work with the state to make sure. I think that there is a little bit of discrepancy on the weekends, how those numbers come in, but we'll work with the state to ensure, and General Barry, that those numbers as well are getting reported.
Okay. So, are you asking about projections?
Well, just 6 weeks from now, once we go back to work and things start going back to normal or resurgence, how do we keep from that happening? Or are we even that far ahead of that thing? How do we protect from a resurgence in 10 weeks?
I don't get the question.
Yeah. So the question is as we go throughout the summer and the fall, will we see a second wave of this? Is the question. And maybe we live with the flu every year, and we go through cycles. At hospitals, we're very seasonal. October to March, when the weather gets colder, the immunes get suppressed, the runny noses, the coughs, the fevers, the sneezing, that all spreads flu viruses and corona A viruses that are already out there. So yes, will we see this, Mike? We will see this continue through the fall, especially since we don't have a vaccination. And I know everybody's working very diligently on that, but we're finding ways to treat it. And Dr. Legan said that mild symptoms, just like the flu today, if you show signs of the flu, we often don't test for it. We just treat you for that. So, but we know that one person can affect up to 50 people, and 50 people can affect 500 people. So we will continue to social distance, and once the emergency declarations are lifted and we're seeing the downward side of the curve, we'll see things back up a little bit. But will we see this in the fall? I absolutely think we will.
Okay, thank you. Okay, well, I mean, the answer to that question is almost impossible today, because this is a new disease. It's a new virus. There is no history on the behavior of this virus. So even the expectation of this might wane and disappear during the summer, which is the typical behavior of respiratory viruses, is an expectation that almost everybody have, including us, but it's not certain because we don't know how this virus behave. Whether the virus will be back in the fall or not, again, we don't know. This virus might eventually become one more of the seasonal flu viruses circulating every year, like it happened before with the H1N1 that became a pandemic worldwide, and then after that just was one more of the influenza viruses circulating and was incorporated into the different variables of the influenza vaccine in multiple years. This particular virus, again, we don't know. Nobody knows what the behavior will be. It wouldn't be surprising that the virus shows again in the fall, because it wouldn't be the first time that a new virus do something like that. The good news is that the most likely scenario is that there will be a vaccine available, but the vaccine probably wouldn't be available before the fall because typically a vaccine takes between 12 months and 18 months, unless there is a successful accelerated process to get the vaccine. But again, there is no right answer to your question because there is no any science supporting any kind of answer because there is no history for this virus.
The question was an update on the isolation beds at Cashman. So the current status in terms of the construction side of that is complete. The key issue has been the staffing and related to really making sure it's the first pre-emergent actually hospital for the homeless in the country. So one of the key pieces that's been focused on is making sure we are prepared in terms of how we flow clients through there. And then secondarily, in terms of providing that isolation in that time frame, we have to have mental health and program support. So the most recent timeline we have, we don't have an exact date yet, but we're looking within the next few days is the hope in terms of having that open, particularly as it ties to the surge in terms of that. So we feel fairly prepared with that, in addition to the other beds that we've identified, because that will also help. So the question was if we've seen an increase in COVID-19 patients specific to the homeless or the vulnerable population. So interestingly enough, if we go back about 2 weeks ago, in terms of those identified beds, we've seen a slight uptick in terms of those in need of placement. The larger issue has been tied to the shelters. So as you were aware at the last conference, we had Catholic Charities that had a positive test, which created some sheltering issues. Secondary to that, Salvation Army also had a positive test, which created a temporary closure for one night. But what we were able to do, and the health district has been great in this, along with our hospitals as we progress, in terms of identifying those clients and getting them placed. So at the current time, from a capacity issue, we feel fairly confident in terms of those clients coming through. Yes, so the question is if we're still exploring availability of motels and other locations. The answer to that question is yes, yes, yes. It's almost an hourly process. What I would want to highlight from our last press conference is we put out that plea for assistance and we did get inundated. We've been able to manage that fairly well. Obviously, there's contractual issues tied to that, but we have been able to do that. And we are still accessing motels, and that's part of those beds you're hearing about both on the WellCare side and the Crossroads side.
Okay, I think we'll have time for one more question after this, but sure, go ahead.
So the question was additional beds and in particular isolation beds. I know every hospital in the community has increased their negative flow rooms to be able to contain viruses within particular containment units within their hospitals. So certainly, and we've all adjusted and converted beds that typically are not either ICU beds or negative flow beds of what we call, but every hospital in the community has made those adjustments to accommodate not only protect the patient, but also protect the healthcare workers and making sure that they had the right PPE in those units. So it has been an impact. So I think that was, turn it back to you, Eric.
Thank you, everybody, for coming. I just want to remind you that if you go to our website at clarkcountymv.gov, you'll find a whole list of resources and information about where you can make donations and volunteer and do other things to sort of help us get us through this effort. We appreciate you coming, and we'll have another update soon. Thank you.